CT allows you to get a 3D view and actually see the overall size. And it's not as dependent on the person who is wielding an ultrasound. And so I feel like it's more like concrete evidence. If I have a patient who has had a CT and we know that there are nodules in the liver or the spleen, then you can actually move and do an ultrasound and get fine needle aspirates of those organs to send them out for a more complete diagnosis. The biggest benefit to me for a CT is not only am I just focusing on the teeth, but I can actually get an overview of how that skull is looking and if there's any other concurrent diseases. Like I said, with like a patient coming in for who isn't eating and you find a resorptive lesion, well, that may not be the reason why he's not eating. It could be because there's a mass occurring in the upper airway region. And so that's where CT would be more beneficial than dental radiography. They're into preventative medicine. They like getting baselines, which is helpful for me, going forward as the pet ages. And so what we'll do sometimes is we'll do a dental, but I might do a bicavity CT with contrast, looking at the chest and the abdomen, just getting a baseline. How are those adrenal glands? How's the liver? How do the lungs look? And then we have a starting point for when they're older, as they age, if we start to have enzyme elevation. So sometimes I'll do it as a preventative measure. Sometimes I'll do it because the patient does come in with high liver enzymes, or, maybe there are some signs of illness that they're worried about, but it's mild. We can do actually CTs of other parts of the body. So the neck, if they're having trouble swallowing, or in the chest, if we're looking for metastasis from, previously having cancer removed. You can also, my abdominal CTs a lot of time are looking at just kind of a 3D image.